So I'm Scott Fitzpatrick. I'm Dr. Scott from Weird Medicine. I was here last year and bored most people to tears with my talk of herbal medicines, and plan on doing the same thing again today. But we're going to do more and get away from the herbs today and do a lot more with pain. And interestingly, one of the guys I ran into out in the hallway has something we're going to describe and discuss here as we go through. So at any point in time, stop me. None of this is anything that we can't get back to immediately. So if you have questions, or if you have questions that you don't want to ask in front of people, I have emails. You can stop me later. It's okay. Just try to catch me before I have too many scotches upstairs, and I might be able to answer a question or two. So here we go. Programmers, players, and pain. I'm going to talk about some integrative ways to approach your health, and particularly overuse syndromes, which is what a lot of us have that spend too much time on computers. Okay, so approach your healthcare as if you were writing code, and then of course, go hack yourself. I say this: approach your healthcare as if you're writing code, because just like writing code, if you do one thing and you expect an outcome, that's what you're going to get. To try to set your healthcare up like you're writing code is vital, because you've got to create a great foundation. Great health doesn't just magically appear. So here we go. Common pain, overuse syndromes, a couple things that we've all had, or most of us have had, and continue to have regularly: lower back pain, neck and shoulder pain, hand, wrist, finger pain, headaches, and eye strain. Okay. So first, really important slide, prevention and treatment. The number one thing that you want to do is not see a doctor. You want to prevent health. You want to stay as healthy as you can be, because the closer you get to going into hospitals and the longer you're in hospitals, the more risk there is going to be regarding your health. So prevention is your responsibility. You can take an active approach to your health by paying attention to your body. Stretching, stress management, meditation, exercise, and diet have all been proven to keep people healthy and out of doctors' offices. Human nature is to avoid pain. That's why they invented divorces. Thank you very much. So an old sage, and I've lived this and believed in this for many, many years. An old sage once said, you're only as young as the flexibility of your spine. And we discussed this earlier, and I should have put brain as well, because the oldest people you'll ever see are the stiffest people you'll see. A young person with a really stiff back and a really stiff spine, they just look old. They don't move well. There's not a lot of flow. And that translates directly to the skull and to the brain. There's this whole CSF, this cerebrospinal fluid movement from your brain into your spine and back and forth. The osteopaths have talked about it for many, many years. And that's the fluid that lubricates your brain, lubricates your spine. It's vital that moves regularly in a very fluid fashion. So if you're not pretty active, if you're not moving around, you're not being fluid, your brain's not fluid. And for those of you in this room, that fluidity is vital. Everybody in here is really smart. That's important that you keep your body as healthy as your brain. So treatments. Let's talk about treatments for a minute. Treatments for pain syndromes are very complicated and involve many moving parts. Your best bet is to avoid injury and of course, avoid doctors. You need to have a knowledgeable primary care health provider that knows all of the treatment modalities and will help you find the most appropriate path. Now, that can be physician's assistants, that can be yoga masters, that can be your physical therapist, your next door neighbor, whoever it is. It doesn't matter if they're knowledgeable and if they understand the system. You do not have to have an MD behind your name to know healthcare. It can come in many different forms. But you have to know the path, okay? So dropping down where you can't hardly see this thing in the red, which I wish I wouldn't have written things in red now. Medicinal, therapeutic, and interventional treatments are all necessary and should be used when appropriate. There's a time and place for every modality. This is a very difficult path to negotiate and should be done with great care. Now, I'm not going to ask you to raise your hands, but everyone in here probably has seen a doctor at some point in time. But how many people in here have ever done yoga? You know, some people enjoy yoga. How many in here have ever had to go through an exercise class or workout? How many people in this room actually exercise regularly? You know, okay, so we got something to do. Good. people ask me if I exercise, and I say, hell no, I don't exercise. That's how people get hurt, and that's how I make all my money. But I'm just kidding, of course. I encourage exercise, and I do exercise a little. Doesn't look like it, I know. But it is important that we all do exercise to a certain degree. And we'll talk about some exercises that are really, really good. The one thing I want to give you guys today is just a real brief overview of some of these things that you suffer from. Because, one thing that we encounter in medicine is a lot of people don't know who to talk to when something is broken. And we're going to try to go through that really quick. And in that way, I'm going to talk really fast. Try to get through this. So if you guys do have any questions, we'll have ample time at the end. So anyway, number one reason for doctor's visits, lower back pain. So what I try to do is hierarchy these a little bit and give you the yellow. The yellow is just an indicator that if you're still on this area, you've got a fighting chance to get better quickly. You wake up in the morning, your back stiff and sore. Is usually you start thinking about poor posture. You start thinking about arthritis, improper workstation ergonomics, your bed stiffness, pillows, and of course lack of movement and physical activity. Now this is a broad pain that's really difficult. So that's when somebody comes in, they have a back pain, but they can't really poke and say, ouch, it hurts here. We typically associate this with a very benign or kind of a very kind of broad term called lumbago. It's just lower back pain. When that moves to the next step, we talk about spasms, intense pains, and movement. We talk about muscle cramps, spasms around nerves, limiting movement, very localized and very easy to isolate. So in other words, somebody comes in with a sore back or sore shoulder, you can push into a very certain space, and you can really kind of isolate that specific muscle, that specific nerve, that specific rib that's out of place. Makes it a lot easier. We start talking about lumbago with muscle spasms, sciaticas, and piriformis syndromes. And again, this is just a really brief introduction. There's only about 10,000 more things it could be. But these are some of the most common things that you'll hear of and that you'll suffer from. Again, spending a lot of time on computers. And then finally, when we kind of get down to the bottom, this red that you can't see very well, the sharp shooting pain, that's when we start talking about possible disc involvements. We start talking about radiculopathies and pains that follow pathways. Now, I don't know how I managed to do this, but I blew that up just far enough where you can't read everything on the right-hand side of the screen. So I apologize. But anyway, these nerve pains follow dermatomes or pathways. Makes it a lot easier for us to isolate and say, okay, if it's coming out this one particular space, it's probably associated with this disc space or this intervertebral disc space, and we can isolate things and do a better job of figuring it out. So you'll hear things like neuropathies, radiculopathies. Those are just nerve pains that are radiating. Sciaticas. Facet joints. Facet joints are little joints in between the in the spine. Nerves come out. They get irritated. They get hot. And they get really angry at you sometimes. Herniated disc, we've all heard of herniated and bulging disc, okay? So that's what you're talking about. This is just a real quick picture of a dermatome. For instance, the young man I was talking to earlier, he had what's going to look like about a C8, C7, C8 radiculopathy. He's getting his nerve pain shooting out into his fourth and fifth fingers. Well, it kind of comes from the lower cervical spine, upper thoracic spine. Yeah, somebody has pain shooting down the back of their leg. We know it's coming from certain lumbar spine nerves, and this is a great little image. Most of you have seen this before, but that's how we know when you've gotten to the point of something pretty serious. What we're looking at. I've got a nice little MRI. It's an enhanced version here, but you can see at the bottom of the screen on the right-hand side, I don't have a pointer, unfortunately, but you can see very clearly the lowest disc is pushed into the spinal cord, and that's going to be where you're going to get these really severe radiculopathies and neuropathies, and sometimes a spinal cord stenosis, which is a narrowing of the canal. Something like this looks on film to be a probable surgical case, but sometimes we can treat it with other things like stretching, like with traction, ice, anti-inflammatories, acupuncture, epidurals, and things of that nature. We're going to get into those in just a minute. And in a real quick slide, I just wanted to show you, this is what happens when you have these bulges in a disc. The center, the little gelatinous part inside the disc, is kind of blooping out the edge into the nerves, the nerve roots. And this is when you start really having some serious issues. So from left to right, top to bottom is obviously the more severe they get. Once you've reached the lower two levels, you're usually talking about visiting a neurosurgeon or a spine surgeon of some sort. Until it gets to that point, which is what I want to preach to you, that we've got some pretty good options. So here are some of the options. Movement and tone. We talk about movement just being any kind of movement, and tone being muscle tightness. Hamstrings are the number one things you got to learn how to stretch. And I'm going to show you how to stretch your hamstrings maybe in a minute. Depends on how much time we have. But when you're at your computer desk, if you'll just sit and have your leg hiked up, we call them a heel hang, where you're sitting in one chair, and then you put your leg onto another chair. It's called a heel hang. It's really simple, and you can do this. I do this when I'm working on the computer. It's a great way to stretch your hamstring. I'm also going to show you another thing. It's a version of that, of some of these yoga stretches, okay? As far as a straight leg stretch, a slight twist, and my favorite is a pigeon pose here at the end. I'll show you that in a minute, and you can all laugh at me and say it's unfortunate for my lack of flexibility. Movement tone, Tai Chi, dance, anything's better than nothing. And so having a structured, rigorous exercise program is not what everybody needs. Some people love it, some people don't, but anything is better than nothing. And then finally, movement and tone, the dead bugs, abdominal strengthening. I'm going to show you how to do real quick some abdominal strengthening without having to do sit-ups. I'm not a huge fan of sit-ups. I'm not a huge fan of crunches, because if you have a lumbar spine pain, sometimes you can really cause more back pain than you need to. And we can do some things while we're sitting at our computer desk without having to, for those of us who are really busy, which most of you are, be able to incorporate these into your normal daily habits without having to take extra time. Layers of treatment, lifestyle changes, physio balls. Those are funky little rubber balls you can sit on. They make you tighten your abdomen. They look kind of weird, but the new ones have like backs on them, and they actually work really amazingly well. Mixing that in with your normal couch or sitting in your recliner is a great thing when you are on a computer all night. Medicines, we have OTC medicines, anti-inflammatories, herbal supplements, and prescription medications all have a good place, but you have to be careful when you're taking any of these things, because any of these medications used improperly or for too long a period of time can cause a problem. Now, we were just talking about earlier today that the newest recommendations in pain medications are that if you have your prescription pain medication refilled one time, then you are technically addicted to that. So if you fall and break an arm, and you go and you get your pain medicines, and you take your pain medicines and you finish that pain medicine, but you have to go back and get another prescription, then technically you are addicted to that pain pill. And that's why this is such an important thing, prevention and learning other types of treatments. As I'm going down these layers of treatments, A, B, C, D, E, we're getting into the lifestyle changes, the physio balls. These are things that you can do on your own to keep from getting further down the list. The further down the list, the worse, and of course, more traumatic and more time and more expensive it becomes. Lifestyle changes are easy. Eat better, get moving. When you get down to the non-invasive therapies, the ice, the heat. Ice is your best friend when you have an injury. And I tell people, if you have a lower back injury, don't ice for 20 minutes. You can ice for hours. Put ice on your back for hours. Let it melt and put more ice on there, and just to keep the swelling up. Physical therapy, osteopathic manipulations are wonderful, wonderful early interventions that can help people fix pain, fix their lifestyle, do some changes before you get to any of these things where you need invasive care. When you get into that invasive care, again, it's the acupuncture, the trigger points, the pain specialists that do the epidurals, the facet, the nerve ablations where they actually cauterize the nerve, and then, of course, surgery is kind of at the top of the rung. We want to avoid getting too far down the line. So remember, prevention is the number one thing. Change these things early. Your lifestyle changes. Most important, okay? So I'm going to do some neck and shoulder stuff. Then I'm going to stop real quick and show you a couple of these stretches, and we'll be able to continue moving on, because I think right now we're doing okay time-wise. Yeah, okay, good. So we're rolling. So neck and shoulder pain, real quick, stiff and sore. This is the introductory kind of stiff and soreness that we all tend to have. We have this tenderness, achy feeling due to fatigue, some pain with movement, feeling the need for a massage, just makes you feel better, and a change in workstation environment. So, and again, this is associated with, and again, I cut it off when I went full screen here, but muscle fatigue and trigger point. So that's when somebody can come up behind you and stick their thumb in a shoulder, sore shoulder, and that's a trigger point. That's where we stick needles, and they feel good, believe it or not. The second, we start getting into spasms and cramps. You have really sore spots. They're tender to the touch, almost too tender to massage. Your range of motion is starting to really get low because of the pain and the inflammation. And now you got pain moving into your shoulder blade and sometimes up into your jaw. We call rhomboidal pain, periscapular pain, which is just of course, your shoulder blade. The TMJ, we'll get a lot of people with TMJ pain, and I'll treat their neck and their upper shoulder just because of the gritting and the grinding of their neck and shoulders and the tension. And then the tendinitis and muscle spasms involved with all this, okay? So the key is when you're having these spasms and you're having these cramps is to intervene here, because the next thing becomes the real problematic area, the sharp shooting pain. This is when we have a true nerve involvement, a probable disc involvement. You start getting some numbness. You start getting some sharp shooting pains. So let's stop for just a second. You think, going back and we had discussed this earlier, going back to the middle, the spasms and the pain and cramps going into the jaw. Of course, a lot of people you'll associate that with cardiac disease. And that's something that you need a great primary care provider to go through and make sure that you clear that. And it's not just a shoulder pain or not just a nerve pain, okay? Don't avoid going to the doctors. Doctors aren't all bad. We just need to be used judiciously. But anyway, getting back to the sharp shooting pain. When you have a numbness or a tingling that is intense or you lose function, that is a really serious issue. Numbness, tingling, a lot of times if you'll take the swelling away, you reincorporate some movement, you take away the insult, whatever that insult is, a lot of times it comes back. It takes time, but now if I tell people, one thing, that if you wake up and you're having nerve pain and it's numb and you can't move it, that's a surgical case, and you need to find a good neurosurgeon or, again, a good spine doctor. Stenosis, you'll hear down here at the bottom right-hand side, you'll hear a lot of people talking about a spinal cord stenosis. This is typically a little more common as we age. There's a narrowing in the canal. You'll get some pain shooting down both sides of the neck and shoulders. Both sides of the legs typically will sit in the lower back. That's a really tough thing to treat. But, stretching, ice, anti-inflammatories, early on, hopefully you won't get to this point, hopefully. Real quick, radicular or kind of a dermatome that we'll use quite often. You can see the branch of these nerves coming from the cervical spine, the thoracic spine, and that just helps us go, well, okay, this is what you're having, so this is probably what you've got. And that helps us be able to isolate, do needles, do injections, do scans, whatever it is, do manipulations, do myofascial releases, etc. And again, stretching of the neck and upper back and shoulder. In yoga, we call this an open heart. We call it threading the needle. There's a different one called threading the needle and twist. And I'm going to try to show you these if I can get. I'm going to try to show you some of these real quickly because I think now we've made up a little bit of time. So upper back stretches, rhomboidal stretches, scapular sets. These are things that are vital that keep you out of the doctor's offices and keep you banging out your work, making people happy, making money, whatever it is you're trying to do. And then C, relaxation techniques, meditation, yoga, acupuncture, exercises. These things are guaranteed proven to keep people healthier. That doesn't mean you'll never get hurt, but it just hopefully keeps you from being too injured. Now, before I do the stretches, I want to go to the next slide, or the next part of this, which is layers of treatment. Number one, elbow support with pillows. A lot of people that have never seen this. One thing you hear about the ergonomics of a desk, you'll hear, well, I have a stand-up desk. Well, that's nice. Or I have a mouse that does flips and is multicolored. Or maybe I have a keyboard that floats in the air. All these things, whatever it is. These things all are nice, but The one thing it doesn't do is take the pain off of the neck and shoulders. So what I like to tell people, truck drivers, people that are on computers all day, every single day, if you think about it, you're doing this. No matter if you're standing or sitting, you're still doing this. You know, you're wearing your shoulders as earrings. You're still doing this. And the way I relate it to people is that, you know, if what's your name? What's your name?
Sarah.
Sarah. Correct. So Sarah and I are going to go out here on Briley Parkway, and we're going to walk for the next 8 hours. How are your legs going to feel at the end of that 8 hours?
I don't know. I'm taking a cab home.
Yeah, you and me both. We'd probably make it at least 20 or 30 minutes, I would hope. Yeah.
Absolutely. And I don't know. I would be tired, but
Yeah.
not as tired as I used to be.
Yeah, sore, pain, hurt like shit, pretty much. Yeah, ouch. Well, what do you think your neck and shoulders feel like all day long? You think about it, because this is what you're doing. You keep your neck and shoulders tucked like this all day long. That's why you have all that tension and tightness. So what I tell people, all of these other things are wonderful, but if you'll take some pillows and put them on your, either in your lap or on your desk or something, and have your elbows here, what it does, it takes all the load off your neck and shoulders. So wherever your screen is now, wherever your mouse is now, you can type and your elbows are rested. So we've taken the load from the shoulders and put it down on your forearms where there's actually some weight, okay? Some distribution of weight, right? This is healthy. There's no more pain here. You should try it while you're dinner type. Put a couple pillows in your lap. Take the pressure off your neck and shoulders. It works amazingly well. You know, and anybody that has anything like that, like I said, truck drivers are great examples. Throw a couple pillows in their laps on either side and takes all the tension off their shoulders. I mean, heck, you know, I look like a genius, and we all know that's not the case. But try it at your computers. Try it at your desk instead of doing the old school, you know, stand-up desk and changing your seats, which I'm not saying don't work, but try this for me. I think you'll be happy. I got way ahead, didn't I? All right. I'm going to stop for a second. I'm going to show you a couple quick stretches before anybody else falls asleep. Sarah, can you move that camera while I'm doing a couple quick stretches? All right. There's a couple things you need. Actually, you don't need my microphone, do you? I'm pretty loud. Number one, hamstring stretch. So if you're sitting here, you're sitting here on your computer. Do this at a couple of different angles. This is called a heel hang. You just want your heel hanging off just enough where there's no pressure in here. Just allow your heel to hang. So while you're typing, this is what you're doing. It's a wonderful stretch. The other one would be, and then just rotate over here. Do this for 30 minutes at a time to get your hamstring stretch out, and it's going to help your lower back. Number one. Number two, I call my figure four stretches. This will help your hip, your lower back, IT bands, piriformis, muscles, all these things. I call them my figure four stretch. Start here, bring it up, and you're just going to lean forward. It's going to stretch your lower back and your hip. Put your elbows down here. That's a whole different stretch. So while you're working on a computer, it's a great stretch. It's so much better than just sitting back, slouching on a computer, banging out. So stretch while you are working. Okay? Those are two separate stretches. All right, I'm going to go to the floor. Are you ready? Are we ready?
He is the expert.
Oh, we have the expert. Couple quick stretches, okay? These are important. These will keep you from being miserable. You can do these while you work on your computer. Is this good right here? Okay. So what you need a couple pillows. They're vital. They're going to make you get in the right position. I'm going to show you the first one. It's called a pigeon pose. You need to sit on a pillow. You're going to sit on a pillow, and you can kind of start in this old, we call it the butterfly stretch. You can stretch like this and work on your computer if you have a laptop. It's a great stretch. If you have one knee that hurts, well, stretch it out and do it like this. Put another pillow here underneath. If this knee hurts, do whatever you have to do to get that thing stretched, and you'll feel better. So I always do this first, the butterfly stretch first, because the next thing I want you to do is roll into what we call a pigeon pose. So I'm going to show you a couple different versions of the pigeon pose. Number one, you're just going to stick with the one leg out. I'm just going to turn to the right. This is a really simple version. But the bottom line is what you're trying to do is stretch the hip on one side and the lower back on the opposing side. And this is your stretch, just a simple stretch. You're turning over the knee that's folded. This is a very simple version. You need to do these stretches for at least 2 minutes on every single stretch. What the research has shown is if you don't have a stretch for greater than 90 seconds, the muscles don't turn loose. So I just tell people, keep it simple, make every stretch a 2-minute stretch. So be supported, be comfortable, but turn into this pigeon pose just like this. This is a simple version, okay? Number one, you can work on your computer like this while you're stretching. It's a great pigeon pose. Put your pillow underneath you if that hurts, if it's too much. Get you a nice little curl here. Or if you're really good and flexible, you can go all the way down. That's your pigeon, okay? It's a great stretch. Use those daily if you can. Let me go back down here while you got the camera down. I'll do the neck ones while I'm down here. A couple quick shoulder stretches. There's 4 simple ones. I tell people just think of the 4 planes of the shoulder. Again, you need your couple pillows. They work best. I always do these in bed or on a couch, wherever I get a chance to do them. But the bottom line is you're going to tuck the pillows underneath your tummy. You're going to start this, we call it tabletop in yoga. This is the open heart I referred to in that one screen right there on A, open heart. So you're just going to roll back like you're going into child's pose, but you're going to extend your arms. Make sure you have some pillows and get comfortable. And turn your head to the neck, turn your head to the left for 2 minutes, and then to the right for 2 minutes. That's your open heart, number one. Number 2, threading the needle. Exact same stretch, except for this time we're going to run the arm straight through. And this is just a great stretch. 2 minutes here. And then if you're feeling really crazy, turn your neck in, or turn your head into the opposing side. Okay? And there's no perfect stretch here. There's no perfect stretch. There's no perfect form. It's just movement, and it's getting some movement. Finally, neck stretch, shoulder stretch. Okay. Supported. Don't let your head fall way back too far and hurt your neck. Head turned to the left for 2 minutes. Head turned to the right for 2 minutes. Letting your arms just fall wherever they go. Get you going back the opposite way instead of always leaning forward. Okay? And I think we got most of those. The twist is pretty simple. You just twist your body. You twist your legs away from where your head and shoulders are. Okay? Oh, dead bugs. One more time, Evan. I'm sorry. One more time. I was going to show you the dead bug exercises. I'll show you them sitting first. When you're sitting on a computer to get some tone in your abdomen, sit up nice and straight, and then all you're going to do is make the hardest abdominal strength that you can. And what I like to do sometimes is just tap myself to make sure that I'm getting tone here. It's a good way to get support and remind you that you're doing something for yourself. Now the dead bugs actually are laying down on the ground. Again, I don't love sit-ups, especially if somebody has back pain. So in lieu of doing sit-ups, here's your dead bug. You're just going to sit, make the hardest muscle you can make in your stomach, and then hit yourself in the stomach, okay? And do that until you can't breathe. Perfect. I used to be able to do a little bit longer than that, quite honestly. Then do it again, and do it a couple times. But each time, take your arms and your legs into different planes to create this balance, which comes from the asymmetry, okay? So tighten it up. You can do a leg out. You can do it on the other side, okay? You can do whatever makes sense, whatever you need to do, make sure you keep tight, okay? What that's giving you is a foundation. And shortness of breath, which is perfect. All right, I think that's all of them. All right, so there's my exercise for the day. See, I did something constructive. All right, that's no more on the floor. I'm tired. All right, questions so far? Back pain, neck pain, shoulder pain, stretches? Hip.
Yeah, this one hates me like right
Yeah,
here.
okay. Okay, so the hip pain, when we start talking about hip pain, again, the hip is a pretty complicated joint, but it usually responds to treatment really, really, really well. The first thing is a hamstring stretch. Do those hamstring stretches, just heel hang, number one. The second thing I always tell people is do that pigeon pose. Okay, laying down. Now, if you can't do it laying down, I'm going to show you a sitting version, and the sitting version is very similar. Like if you're sitting on a couch or if you're sitting in a recliner, I'm going to show you the perfect way to do it, because I do this a lot when I'm actually in clinic. I'm working with people. They don't know I'm stretching, but I'm actually stretching while I'm interviewing them. Okay, so what you'll do, imagine if I have a recliner or a couch that has an arm here. Okay, so we're sitting here like this. So I can make this. Imagine there's an arm here. Okay, go back to your figure 4 stretch. Okay, here's your figure 4 stretch. Just turn your whole body into that arm of that chair, and use that arm as a lever. Okay, so you're leaning over, and that's your stretch. Now get the whole hip, but do both sides. And if you want to, if you've got a chair with arms, like your computer chair, what I would do is I would do the same stretch and turn that whole chair into the computer screen. Okay, so here's your computer screen. Do your stretch, turn here. And let that thing stretch while you're working on it. It's really going to get the hip, because what happens is when you get a bursitis in the hip, probably or piriformis kind of thing, is you've got all these muscles pulling on that joint space, and it gets really irritated, man. And it does respond well to stretching. And if not, we can put little needles in there. It feels great. No drugs, no nothing, no surgeries, just gentle stretches. Ice is always a great thing. If it hurts at night, if you're laying on it at bedtime, it's bursitis. Ice it and stretch it before you go to bed.
Nice.
Yeah, and if you're up walking around, but if it's, of course, there's different things for different hip pains, but that's kind of what it sounds like. Yeah. And again, if that doesn't answer it, you can email me, and I'll be happy to send you some other stretches. But try the pigeon; it's my favorite. All right, good. Other questions? Neck, shoulder pain. We talked about the neck earlier. Eyes, stretching. Yoga is just one of the best things ever. As far as keeping you out of doctor's offices. And there's other types of exercises. There's a million of them. Just find something that suits your style. And that's all I would say. So let's see. How are we?
You have 28 minutes.
Okay. All right, so we're still good. I don't think I got that much more wind. All right, let's go to hand, wrist, and finger pain. Now, of course, hand and wrist finger pain is kind of a weird thing. Sometimes they're really easy to treat, and it's just taking away the insult. In other words, it's not typing on a keyboard that's tilted away from you or tilted back too far. You like your wrist to kind of be in a neutral position. That tends to help a bunch. But here's the thing: just like anything else, you talk about soreness, stiffness, tingling sometimes. That resolves when you change positions. That's a good thing. That's when we really have to jump on it quickly. Better with rest, better with stretching, better with change in positions. That's typically overuse syndrome. And of course, overuse syndromes come from any kind of mechanical thing that you're doing way too often. The gamer's thumb is a great example of that. Sharp pain associated with movement and really doesn't get much better at rest. You start thinking about some other more severe things like a carpal tunnel syndrome, sometimes a de Quervain syndrome, trigger fingers, lateral epicondylitis, tennis elbows, golfers' elbows, things like that tend to be a little bit different, and certainly disc herniations in the neck, stenosis in the neck, so narrowing of the canal, and some bone spurs. And again, these things come and go. Sometimes they're easily treated. Sometimes they're just a bear. But the best thing you can do is not get to that point. Okay? So prevention, stretches. I tell people, prayer stretches, one of my favorite stretches for the wrist and the fingers. You just pull your hands right in front of your face, and you're keeping your palms together. You just go down the front of your chest, right up against your chest, as far as you can go comfortably. And just breathe and let your hands and fingers and wrists stretch. Then you do it the exact opposite way. You put your wrist together, pull them up towards your chest, keeping them right up against your chest. Again, it's great stretches for your wrist. Tai Chi rolling, just simple stuff. You'll see people doing their Tai Chi rolls, and it's nothing more than movement. You can call it anything you want, because there's 1,000 different names depending on what country you're from. But they're all just movement. And B, changing an angle neutral, again, is the best. You don't want your fingers reaching too far down or being pitched too far back. And, of course, any kind of gaming appendages, you have to make sure that you have in the right position. Now, layers of treatment, again, you got to change the insulting agent. So what is causing the issue? If it's a joystick, whatever your joystick may be, make sure that you use the appropriate joysticks. Braces are great short term. Medicines are great short term. All these interventions are great short term, but you really need to make some changes because you don't want to have to use these things for too long. Medicines, there's OTCs, there's herbal supplements. One herbal supplement I love is called curcumin or turmeric. It's a natural anti-inflammatory. Non-invasive therapies, ice. Again, ice is your best friend when you're injured. You're swelling. You want to stop the swelling and you want to stop the insult. Okay, you can do massages. Massages are wonderful for things like this. Osteopathic manipulation, sometimes it just takes moving a bone in the wrist back in place to get better. And then we start talking about other things. I see in using acupuncture a lot on carpal tunnel syndromes, and it works really well, but it doesn't feel great. So we like to get it before it gets to that point. And it's not 100%. The pain specialists are great. The new hand surgeons, they've got some new techniques where they're doing carpal tunnel releases, which are super duper effective and much less invasive than they used to be. But you got to find the best hand surgeons. You got to find people doing new techniques, and you need to really try not to get there if at all possible. Okay, eye strain. Eye strain is one of those things that we really don't pay enough attention to. Eye strain can lead to a lot of ailments. You think about evolution. We're supposed to live in a 3D world. We see things in three dimensions for the most part. That was why we grew up being hunter-gatherers, recognizing that, tigers were running after us, whatever. Computers make it tough to do that. The two-dimensional worlds make it tough to focus. I see a lot of kids now that spend too much time on computers have a lot more difficulty hitting baseballs, shooting basketballs. They have a little bit more trouble focusing, using that binocular vision and judging distance. It's or as we'll call it tracking. Sometimes they just don't track as well because they don't use it enough. And your eyes are no different. The visual cortex in your brain is no different than any other muscle or any other part of your brain. If it's not used, you lose it. So it's really important that you use your eyes and exercise your eyes, I guess is what I'm trying to say. And in eyes, you use consistent extra effort to keep focused on screens. RSI of the eye muscles, just like back and neck and arm spasms, the same thing. If you don't use them, you have these overuse syndromes of the eyes. No different. So I put eye strain and headaches in together. Headaches are not always associated with eye strain, but it's really important that if you have headaches and again, headaches are a whole nother topic. It's a whole year's worth of topics in headaches. But the bottom line is if you have eye strain and some associated headaches, you'll tend to have muscle pain, blurry vision, dry eyes, gritty feeling, changes in perception. Some things we can do to treat those things. We have trigger points, and trigger point therapies, massages, things like that, and they tend to get a little bit better when you take your breaks from computer. Headaches, in my practice and in a lot of practice, are one of the most difficult things you can have to diagnose because there's so many moving parts with headaches. One thing to always remember, new headaches or changes in headaches need to be really kind of thoroughly evaluated because you just never know. But chronic tension headaches, sinus headaches, eye strain headaches, these things we can really work on. But, we kind of go back to the slide before that we were talking about changes in lifestyle, making some positive changes in what you do. Consistent eye fatigue, increased general fatigue, increases nearsightedness, which is your myopia, and also postural changes. So, a lot of us have postural changes, we don't even realize it. And I think sometimes it takes somebody looking and saying, hey, you're slouching, you're walking crooked, whatever it is, because sometimes if we've been doing it for a long time, we just don't realize it. So trust whoever it is to tell you the truth and to get you back into line. Okay? A couple things we can do for this fatigue, for the nearsightedness, for postural changes, find a good optometrist. Find a good eye health. Physical therapy is great. Massage therapy is great. Osteopaths are wonderful because they can help you move things. Acupuncture sometimes is pretty good for it. So there's a lot of great things. The next sentence here is really an important sentence. Think of your eyeglasses like shoes. Different types of lenses do different things, just like different types of shoes. Sometimes you need flip-flops, sometimes you need mudders, and glasses are no different. I'm wearing some designer glasses you can see that we picked up at the Dollar General store for 99 cents. The plastic glass, which is, it works, but it's not ideal, and I need to, follow my own advice and actually go get some proper glasses. But it's true. Get some people that know what they're talking about, that you can trust, and get the proper lenses for what you do. Real quickly, as you can tell, the recommendations are, as far as we can tell, white screens, black letters. It's easier for your eyes to read. They don't have to work so hard. Prevention, real quickly. Prevention, we like to take breaks every 2 hours. Reassess posture. Remember to blink. One thing I like to tell people is when you're working on your computer, is take your eyes away and find the furthest point away in the room, and it's typically a corner, and focus on that corner because you have two groups of eye muscles in your iris. One kind of wraps around like this, and the other ones are kind of doing this, right? So what you want to do is change those and allow the opposite muscles to work. It's the opposing muscle theory. So you want some to work while the other ones rest, and back and forth. Okay. So movement, position monitor. At your eye level, 18, 20 inches away, wipe down the screen with for the anti-static. Fix all of these things, the contrast, the glare, and decrease the blue light because the blue lights are really tough on your retina over a long period of time. Okay? So real quickly, incorporate these things. They will make you better. Regular optometrist visits, we spend too much time reading and on computers, but that's just what we do. It's not like there's a lot of options. Proper diets. There's a lot of great supplements out there for ocular health. Great supplements. Acupuncture is kind of an interesting thing. There's actually some acupuncture points that actually stimulate the visual cortex of your brain. That doesn't do a whole lot for your eyes, but it can help your brain. It's your job to work your eyes. This 20-20-20, every 20 minutes, look at something 20 feet away for 20 seconds. Again, that's that whole opposing muscle theory. And to decrease accommodative spasms, you want to focus on something again, up close, far away. Again, that's to decrease the spasms in your eyes and your neck and shoulder. Results of the RSI of eye strain, poor posture, headaches, further damaging of the eyes. The eyes you really, 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 really need to protect. Those are one things that if you've ever been around people who are visually impaired, you just don't want to lose your eye function. And then again, overall insufficiency. And again, me wearing these readers every day is not a great thing, so I need to pay more attention to this particular screen. All right, take-home messages. Most important things. Pay attention to your bodies and its warning signs, number one. Number two, portion control is your best friend. Eat, drink, do whatever you want as long as it's in moderation. That's very important. If you love chocolate, eat a little bit of chocolate, unless it gives you migraines or you're allergic to it, of course. But eat a little bit. If you like drinking beer, drink you some beer. Just, don't do too much. Find a healthcare provider that listens to you and is well-versed in all forms of medicines, but does not have an ego to feed or multiple ex-spouses. That's the number one way to determine if a surgeon's a great surgeon or not. How many ex-spouses do they have? It's a true story. You can look it up. Don't drink any sodas. Of course, without liquor. Sodas are the worst things you can drink. Liquor's, it's good for you. Don't smoke. Cigarettes. Cigarettes will kill you. One thing I love about cigarettes is you're going to get one of two things if you smoke them. Lung cancer, COPD. They're consistent, and that's okay, and we treat all those things, but don't smoke. Don't smoke. Invest in your health. Invest in your health as much as you invest in other things. Your 401ks, your computers, whatever. And of course, finally, get off your asses and get moving. And that, my friends, is it. Questions? Anybody? Takers. It's 6:01. I did good.
You did great.
I did good. I got us back on time. Question?
Yeah, you mentioned using the right type of lenses for the right task. I've seen some people use like gaming glasses, which are in theory, I guess, supposed to help reduce glare and
Right.
damage.
Yeah.
Does that actually make a difference?
It does make a difference, yeah, absolutely. And I don't know, as far as a website, But there are some very, very specific recommendations as far as different types of lenses for different things. And I don't know that specifically. That's not my forte. But if you'll email me, I will find you those links, and you can actually find specific things. And again, it's just like shoes. If you don't pay attention to the lens that you need specifically, you're not going to help your eyes. Give your eyes a break. We use them. We wear them out all day long, and then stare at a computer for hours and hours and hours. So we got to do it. So yes, the answer is yes, absolutely. Yeah, we just need to find out a good website to go to. Any other questions? Anybody? Again, if you got anything that you don't want to ask in front of everybody, send me an email. I'm the one that gets all the good, weird, funny stuff. So please send me an email. I enjoy them. And actually, after last year when I spoke, I did have a couple good emails. Don't forget your pigeon pose and your hamstring stretches, et cetera, et cetera, et cetera. And remember, always stretch 2 minutes. 2 minutes unloaded to really get a good long stretch, okay? All right, thank you, guys.
When's your show?
Appreciate it. Saturday nights at 10 p.m. It's not for virgin ears. You can always find us. We do a podcast called Weird Medicine with Dr. Steve, and he's an amazing person. One of these years we'll get him to speak here instead of me. He's a whole lot more funny, and much more of a computer whiz than I am. So yeah, Weird Medicine. So you can send us any emails you want. The weirder, the better. Again, any other questions, you guys can catch me. Hopefully we'll be up floating around. Thank you, guys. All right. I managed to do the stretches without falling off of the table. Oh, man, I tell you.